Hi, I'm Alexis Cate. I'm a licensed clinical social worker and trauma specialist. Let's talk about medications for depression. Please make sure to check out the description below this video in order to review the resources that we discuss. In this video, we'll discuss antidepressants, different types of antidepressants, the side effects of certain medications, and other medications for depression. Depression is a common mental health condition. Sadness, fatigue, hopelessness, and low motivation are often symptoms that are associated with depression. These symptoms interfere with a person's ability to function in everyday life. In many cases, medications are necessary in order to provide relief of depressive symptoms. Antidepressant medications. These medications work to increase certain chemicals in the brain. The increase in these chemicals lead to the improvement of depressive symptoms. Dopamine, serotonin, and norepinephrine are neurotransmitters, which are chemical messengers in our brain. And these neurotransmitters are most closely linked to depression. They affect mood, energy, and motivation. People with depression are found to have a deficit in one of these neurotransmitters, and this can at least partially explain the symptoms of depression. There are many individual factors that will determine whether or not antidepressant medications will be effective for an individual. And it often takes more than one trial to find a medication that is right for you. The decision to start a medication should always be done in collaboration with a doctor or other medical professional. These are professionals that can support you in weighing the risks and benefits of taking a medication. Your pharmacist and doctor can answer any of your questions. Selective serotonin reuptake inhibitors, or SSRIs, are most commonly prescribed to treat depression. They are a first-line medication option for depression treatment. They are generally effective and well tolerated, with few risks and adverse effects when compared to other antidepressants. SSRIs work to block the reabsorption of serotonin, which means that there is more plentiful serotonin in the brain. Serotonin is most closely related to mood, so having a deficit of serotonin will lead to symptoms of sadness, anxiety, and general moodiness overall. Most commonly prescribed SSRIs to treat depression include citalopram or Celexa, sertraline or Zoloft, escitalopram or Lexapro, fluoxetine or Prozac, and paroxetine or Paxil. These medications do have a black box warning for increased risk of suicide. A black box warning is the most serious warning from the FDA. We've linked articles that we've published regarding SSRIs mentioned above for further reading. While SSRIs are considered to be mostly safe and have a low risk profile, they do run the risk of side effects. The most common side effects of SSRI medications include headache, drowsiness, lack of sexual desire, erectile dysfunction or trouble reaching orgasm, changes in appetite, weight gain or weight loss, insomnia, nausea, or upset stomach, anxiety, and or irritability. Serious and life-threatening side effects of SSRIs include serotonin syndrome, which is a serious condition that results from too much serotonin being in one's system. The symptoms include agitation, confusion, dizziness, tremors, and marked changes in heart rate and blood pressure. Emergency medical care is required to treat this condition. Suicidal thoughts. Children, teens, and young adults under the age of 25 sometimes experience an increase in suicidal thoughts and intentions after starting an SSRI. This is a rare side effect that mostly affects younger people. However, it is incredibly important to be aware of. Tardive dyskinesia. This is a rare disorder where a person suffers from uncontrollable movements or tics, which are usually associated with long-term use of antipsychotic drugs. However, they have been occasionally linked to SSRIs as well. Please be advised that this is not a complete list of all of the side effects. Please consult your physician for more. Serotonin norepinephrine reuptake inhibitors, or SNRIs. These are another commonly prescribed type of medication for depression. These medications work on both serotonin and norepinephrine neurotransmitters in the brain. While serotonin affects mood, norepinephrine is developed in our adrenal glands and is more closely linked to our energy levels and our focus. SNRI medications commonly prescribed to treat depression include desvenlafaxine, Pristiq, duloxetine, Cymbalta, levolmeloxicam, Fatsima, venlafaxine, Effexor, XR. Again, we will link articles that we've published to discuss SNRIs for further reading. SNRIs are similar to SSRIs because they do focus on serotonin receptors. In addition to the common side effects of SSRIs, SNRIs also cause other adverse effects. Adverse effects of SNRIs include nervousness or anxiety, dry mouth, an excess in energy level, a loss of appetite, high blood pressure, and an increase in suicidal ideation. Again, this is not a comprehensive list of side effects. Please consult your physician for more information. Tricyclic and tetracyclic antidepressant, TCAs. These are an older class of medications that were once commonly used to treat depression. Now they are prescribed less often. They are often only prescribed when SSRIs and SNRIs prove to be ineffective. TCAs work on multiple receptors within the brain, and the result is an increased level in norepinephrine and serotonin. The only difference between tricyclic and tetracyclic drugs are how many rings are in their chemical structure, 3 versus 4. TCAs prescribed to treat depression include amitriptyline, amoxapine, desipramine, norpramine, doxepin, imipramine, tofranil, nortriptyline, pamelor, protriptyline, trimipramine. These medications also carry a black box warning by the FDA for an increase in suicide. Again, a black box warning is the most severe warning from the FDA. TCAs are just as effective in treating depression like SSRIs and SNRIs. However, they come with more adverse side effects, and these side effects can be serious. Side effects associated with TCAs include dry mouth, constipation, dizziness, confusion, sedation, drops in blood pressure, weight gain and increased appetite, and trouble urinating. More serious risks associated with TCAs can include cardiac problems, which can be fatal, seizures for those with epilepsy, increased suicidal ideation in those under the age of 24, serotonin syndrome, withdrawal symptoms when stopped abruptly, and birth defects, specifically in the ears, eyes, neck, and face. Monoamine oxidase inhibitors, MAOIs. These are the oldest type of antidepressant medications. They work by blocking out a particular enzyme that is associated with clearing out serotonin, norepinephrine, and dopamine from the brain. By blocking this enzyme, monoamine oxidase, MAOIs make these chemicals more available in the brain, which helps with deficiencies in these chemicals that are associated with depressive symptoms. With similar adverse effects to TCAs, MAOIs are usually prescribed only when SSRIs and SNRIs have proved to be ineffective. MAOIs commonly prescribed for depression include Marplan, Nardil, Emsam, Parnate. These medications also carry a black box warning for the risk of suicide. Again, a black box warning is the most severe warning by the FDA. Common side effects of MAOIs include dizziness, headache, dry mouth, nausea, diarrhea or constipation, sleep problems, drowsiness or insomnia, skin rashes, trouble urinating, lower sexual desire, difficulty reaching orgasm, weight gain, muscle cramps, tics or jerking, a tingling sensation in the skin, and lowered blood pressure. In addition to these known side effects, MAOIs also come with serious side effects, which include increased risk of suicidal ideation, particularly in younger people, tardive dyskinesia, dangerous interactions with certain food and other medications that can cause a severe spike in blood pressure, serotonin syndrome, and it may be harmful for unborn babies who are exposed in utero. It is also associated with dangerous withdrawal symptoms when stopping abruptly. These can include the risk for convulsions, psychosis, and flu-like symptoms. This is not a comprehensive list of side effects. Please consult your doctor for more information. While most antidepressant medications fall within one of these above categories, there are some few outliers. Some medications prescribed for depression are atypical, but result in the increase in neurotransmitters that are needed in the brain to alleviate depressive symptoms. These medications all work on one or more of the neurotransmitters associated with depression: serotonin, norepinephrine, and dopamine. Common antidepressants that do not fit the 4 classes mentioned above: bupropion or Wellbutrin. This is an antidepressant that works on norepinephrine and dopamine receptors, and it is also prescribed for smoking cessation, ADHD, and for those concerned about weight gain as a side effect of medications. Trazodone. This is an antidepressant that works on increasing serotonin, and it is often prescribed for those suffering from insomnia. Remeron. This is an antidepressant that works on increasing the amount of noradrenaline and serotonin in the brain. Nifazodone, an antidepressant that works to increase the amount of serotonin in the brain. Dextromethorphan bupropion. This is a brand that is newly FDA-approved medication in treating depression, mainly in adults. Auvelity is a brand new FDA-approved medication for treating depression in adults. This drug is the first approved medication targeting NMDA receptors, which possibly opens up new avenues for treatment-resistant depression. While antidepressants can be incredibly helpful, it is so important to know about the side effects that come with certain medications before starting them. Please talk to your doctor or prescriber about any concerns you have before starting a new medication. How long will you have to take medications for depression? The length of time you may need to remain on medications will depend on individual factors. These individual factors include your personal needs and other medical circumstances. Some may be advised to stay on medications if it was their first depressive episode. However, those with major depressive disorder and a history of multiple episodes may be advised to take it for 1 to 3 years or in the long term. The timeline of medication is really based on your unique symptoms, your history, and how you adjust to medication. Final thoughts on medication for depression. If you've been dealing with depression, you may want to talk to your doctor about medication. Especially when combined with therapy, antidepressants can make a big difference in quality of life. We've linked valuable resources in the description below to support you in finding a therapist, psychiatrist, and other useful tools.